Uhuru. Uhuru, everyone. I want to welcome you all to a very special Facebook Live sponsored by the All African People's Development and Empowerment Project, also known as ABDEP, and IFCO, the Interreligious Foundation for Community Organizing. My name is Michelle Odom. I'm ABDEP's Medical Programs Coordinator and the producer of our Ask the Doctor series. Our webinar today is titled Africans United with Cuba, Confronting COVID-19 and the US Blockade. And we will feature presentations from organizers with the Interreligious Foundation of Community Organizing and the All African People's Development and Empowerment Project. If you haven't already submitted your questions for our panel, please do so in the comment section below on Zoom, or if you're watching live on Facebook. And don't forget to like and share today's webinar. Today's webinar has the goal of learning about Cuba's success in fighting COVID-19, including their vaccine development, learning about the US blockade against Cuba, learning about ELAM and the opportunities for Africans to attend the Cuban Medical School. Also today, we want to build and learn more about how to build the capacity for ABDEP and Project Black Ankh to continue to develop our capacity to respond to medical emergencies and natural disasters in the African world. Please see the comments for information about ABDEP and IFCO and how to join, or to join for ABDEP, you can go to www.developmentforafrica.org/membership. Again, that's www.developmentforafrica.org/membership. All right, well, we have an exciting panel today, which includes Executive Director of IFCO, the Interreligious Foundation for Community Organizing, Gail Walker. We also have the coordinator of the Latin American Medical School, also known as ELAM, Dr. Samir Adri. Also, we have director and founder of EAM, Science Education Group, Dr. Michelle Strongfields, nurse practitioner and ABDEP's Medical Programs Coordinator, Dr. Loretta King, and director of the All African People's Development and Empowerment Project, Dr. Aisha Fields. We are excited for today's panel and we're ready to get started, so we're going to jump right in. We're going to begin today's discussion with our first presenter, and I'm going to introduce Gail Walker, the director of IFCO. Gail Walker worked with IFCO from 1987 to 2002 as a communications director and co-led the 1988 IFCO delegation to Nicaragua that resulted in the formation of Pastors for Peace project. Through Pastors for Peace, citizens were offered the opportunity to enact an alternative people-to-people foreign policy rooted in justice and mutual respect. During her early years at IFCO, she led a number of delegations to Central America and Cuba and staffed a number of Cuba friendshipment caravans. After years of working as a journalist and communications professional in print, video, and radio, Gail returned to IFCO as director in 2011. Under her direction, IFCO staff have organized many Cuba friendshipment caravans and educational delegations to Cuba. IFCO has also continued to facilitate the process of dozens of US students to study medicine in Cuba under full scholarship and to expand its support for grassroots organizations working for social justice. Director Gail Walker, I want to welcome you to our program today. We are so honored to have you with us today. Uhuru.
Uhuru, and thank you so much, Michelle, and good morning, good afternoon, depending upon where you're joining us from. We're just so pleased to have you here. I want to extend my appreciation to this entire family, to the organizers of this event, and the All African People's Development and Empowerment Project, of course, as well as Black Ankh, for the invitation to be here today. You could have been anywhere else on this Sunday, but you're here and we truly appreciate your joining us today and providing an opportunity to hear more about the work of IFCO Pastors for Peace as it relates to Cuba, and particularly in its valiant fight against COVID-19. We have been wanting to strengthen our relationship with ADEP and Black Ankh and see today's event as a way to advance that commitment. We at IFCO Pastors for Peace simply couldn't do our community-based work, and particularly our Cuba solidarity work, especially our annual Friend Shipment Caravan, without the support of our global network of friends and justice-loving partners, and this includes all of you. As you all know, COVID has taken a major toll on the global community, and especially on our African community across the diaspora, and has made travel to Cuba very challenging. After many efforts to get there, I, along with IFCO's medical school program coordinator, Dr. Samira Adri, who you will hear from next, finally made it. And we just returned after a 2-week visit to the island. It had been nearly a year and a half since I'd been there. And what I witnessed underscored the importance for us, Cuba's friends, to return as soon as it's safe to do so, possible, as soon as it's possibly safe for us to be there. As a medical professional, a Cuban trained medical professional, Samira Adri will be able to speak better about Cuba's vaccines and the other efforts Cuba is engaged in its fight against COVID. I'd like to talk in a more general, broad sense about the current situation there. But first, we want to share a few minutes of a video highlighting the work of ELAM students as it relates to the fight against COVID. So if we could just pull up that video clip, Chio, I'd appreciate it. And we can just share a few moments of it.
Approach in the fight against COVID-19 starts off first and foremost with an emphasis on prevention, and that's preventing the virus from entering the country and then preventing the virus from entering certain neighborhoods. In areas where there are positive cases of COVID-19, the goal is to contain the virus, and all of this is done with the participation of sectors from every aspect of life, from doctors, from medical students, other healthcare workers, and more importantly, members of the community.
Whereas Cuba's approach to fighting COVID-19 is a proactive one, which makes sense because the healthcare system is founded upon preventative medicine. When the pandemic really started to take shape, Cuba did a great job of preparing their citizens on what to expect from the coronavirus, what are the signs and symptoms, what do you do in the event that you get these signs and symptoms, who is the at-risk population.
The Cuban system is vigilant in that medical professionals actively look for cases rather than waiting for patients to come to them. In Cuba, the pesquisaje is used as one of the first lines of defense in prevention. Cuban medical professionals visit all the houses in their assigned communities in order to check up on their community members. It is used as a tool in order to prevent and control the spread of certain diseases, as well as a tool to collect biostatistical data.
We go into the communities, to people's homes, to see how is their home environment, how is their house, how is the community itself and the hygiene of the community, as well as other issues.
It's really important to identify potential cases in the community. That's the main objective of the pesquisa, but it's also a great way to remind the community about preventative measures and actions to take to fight COVID-19.
We come here to the communities, we talk to upwards of 50 patients a day in their households, and we ask them who lives there, if there are any patients that are showing symptoms, if there's any patients that are over 60, which is considered a risk factor, and therefore we add those numbers up and then we give them to the professor to then tabulate all this information and have it available for the people in the polyclinic to follow up on.
For me, I've been going to the same neighborhood, the same block, for maybe more than a month. So around now, I know the names and faces of like 60 plus homes, and they also know my face. When I don't go the next day, they ask me where have I been. For me, that's what community health looks like, is where you get to know your patients.
Before now, we have done pesquisa yearly for dengue during its peak times. I feel as though during pesquisa is my way of contributing to assist in saving lives as a future doctor in training.
When the first case was discovered later on in March, Cuba readily made available the resources necessary to isolate and treat confirmed cases, recognize and quarantine suspected individuals, and conduct tests to diagnose or rule out suspected cases. The preventative measures have been active and not passive. That is because the cases are sought out. Within communities with confirmed cases, there are mass screenings and testings conducted.
When you get tested, if your test comes back positive, you are going directly to the hospital. You are ingressed, and you are going to a specific hospital attending to all COVID-19 patients.
A couple of differences between the Cuban approach and the American approach to fighting COVID-19 is one that Cuba has a central and universal healthcare system, whereas in the United States of America, we do not have a universal healthcare system, where we do not have a healthcare system at all. And one of the advantages to that is that everybody on this island gets care irrespective of income, race, et cetera, or any other determining factors. If you are symptomatic, that is known to be a risk for the entire country, and therefore you receive treatment. So what you are hearing right now is the applause that every night at 9 p.m. Cuban people everywhere, all across the country, go out on their balconies, their windows, and show their appreciation for all the healthcare workers in the country who are really sacrificing and putting themselves and their families at risk to try to eradicate this virus on the island.
Cuba has shown its solidarity with the world by sending its physicians abroad to aid in the fight of this pandemic. Some of the countries that have benefited from this aid are China, Italy, Jamaica, Togo, Mexico, amongst many. Even the UK benefited from Cuba's aid when it accepted to receive and treat infected UK citizens.
Elam teaches you to be ready for anything, and Elam teaches you to go where you are sent, to go where the crisis is, to go where the need is.
It has also stressed the importance of having a plan, having preventative measures, and also the importance of having collaborators, both domestic and international. In this case, it is one world, one fight.
It is amazing to be a part of a nation right now that has a human-centered approach, not because it's new to this pandemic situation, but because that is the structure of the Cuban healthcare system, to value people, to value humans, and it's not a business.
This really places into perspective the importance of having a system in place for when the next crisis hits.
It's an honor to live and learn in this system. I hope our communities back home will learn from this example and actively seek out the health of present and future generations. And it is clear that as COVID-19 respects no color or creed, our health system and society in general must learn to value all human life regardless of color.
Call me, call me. When you need a friend, call me. Call me.
Great, thank you so much. It was kind of difficult to figure out where to make the break there, because it's just so heartwarming to those were ELAM. ELAM is a Spanish acronym for the Latin America School of Medicine, but ELAM students that were out on the street, actually putting their training into practice and showing what it means to be a Cuban trained physician in this fight against COVID. And you'll be hearing more about that work and the program, as I mentioned, from Dr. Adri. But as I said, it's clear that right now the Cuban people are suffering as a result of multiple attacks. In addition to combating the devastating pandemic, threatening the very existence of the small nation, Cuba, of course, continues to confront the longstanding US government blockade, not a unilateral embargo, but a full-on, multifaceted blockade. And third, the lack of tourism, which has had a direct impact on Cuba's economy. For those of you who don't know, since 1992, IFCO has been organizing French shipment caravans to Cuba to help educate people about the reality there and to challenge our government's genocidal blockade that has attempted to pressure the Cuban people to rebel against its revolutionary leadership through the denial of foods and medicines and trade opportunities, not just with the US, but with other nations. And this cruel, unjust, immoral policy has been a centerpiece of the US government's policy toward Cuba since shortly after the triumph of its socialist revolution in January 1959. As people of faith and people of conscience, we here at IFCO Pastors for Peace have always believed in Cuba's right to self-determination and valued the tremendous gift the revolution has brought to so many in the world, but especially for Cuba's regular everyday citizens, those who benefited when the Fidel Castro and company overthrew the Batista dictatorship, which plagued most Cubans with hunger, poverty, illiteracy, and the lack of basic health care. The blockade attempts to throw Cuba back to those days, and we particularly, as people living in the belly of the beast, along with the international community, are committed to speaking out and acting out against that policy and working to prevent further harm. The difficulties that Cuba is being forced to endure at this time is why we know that it is more important than ever that we organize our friendshipment caravan to go this year. We were prevented from doing so last year due to COVID. We know that Cuba needs our support, especially today. And after the aggressive policies that Cuba has been forced to tolerate under the Trump administration, policies that the Biden administration has yet to reverse, despite campaign pledges to improve relations with Cuba, there's no doubt that Cuba needs our friends now more than ever. My first trip to Cuba was in 1992 at the height of the special period. Due to the collapse of the Soviet Union, Cuba lost its primary trade partner. Many of you will recall that there were barely any vehicles on the streets, food was scarce, there was a reduction in energy resources, rolling blackouts, etc. It was truly a devastating time for the island. And that's why 30 years later, it is so incredibly remarkable to see how Cuba has been able to bounce back, to support not only its own population, but to offer life-saving support to people suffering in other countries across the globe due to natural disasters, including hurricanes and earthquakes and life-threatening illnesses such as Ebola. And we fast forward today to providing medical assistance in the fight against COVID. In true Cuban fashion, as others ran from the fight to save lives, the Cubans ran towards it. It's difficult to briefly sum up what is happening in real time in Cuba, but as I said, in short, there are those multiple assaults on the island and its people. The blockade is more cruel, more cynical, more criminal than ever, not just because of Trump's more than 200 plus additional measures imposed to tighten the screws, not just because Biden is maintaining this policy, continuing and in fact tightening even further the stranglehold that is the blockade by making baseless accusations that Cuba is refusing to fight terrorism, but also because it is another blow to an already besieged country that against all odds is struggling against the impact of the pandemic. The blockade is draining the medication supply more than it has in a very long time. Analgesics, vitamins, antibiotics, and critical medicines are scarce and are found at increasingly higher prices on the alternative market. When we were in Cuba, it was heart-wrenching to hear a surgeon report that he couldn't perform surgery because he couldn't provide antibiotics or pain meds to his patients because there simply are none. The economic changes that have also clashed with the already difficult struggles that are caused by the blockade are real. And we have to hold the US government accountable, not just the Trump administration, but the current one too. In 2019, 700,000 Cubans sent 1.5 billion with a B, $1.5 billion in remittances to Cuba, to their families. That's gone. And cruelly, Biden has not reinstated those remittances. Trump put Cuba on the list of states that sponsor terror, but Biden is now claiming that Cuba is not cooperating with the fight against terrorism. The new generation of leadership in Cuba, led by President Miguel Diaz-Canel, is pushing everyone to get to work. He's been traveling from province to province before and after the recently held 8th Congress of the Communist Party. The Cuban leaders are in the trenches with the people. We saw deserted office buildings with some officials working from home and others actively participating in all COVID-19 control activities, and especially now that the mass vaccine campaign is underway. And then there's the impact of COVID. Samira will talk more about this, but still, while Cuba is confronting this deadly scourge, it is important to note that the recovery rate is 95.3%. Cuba's doing what it can to contain this virus. Despite the blockade, the vaccination campaign is underway in Cuba, as I said. It's a people's campaign, community-based, neighborhood by neighborhood. It is beautiful to see the pride the Cuban people have in the vaccination program as each person waits their turn as their province, their neighborhood is vaccinated. Cuba is committed to having at least 70% of its population vaccinated by August and is on board to become the only Latin American country to develop and manufacture its own vaccine against COVID-19. Cuba's done tremendous work to create 5 internationally recognized COVID vaccine candidates for its people. And Cuba's committed to not only care for its people, but to share its vaccine with others in the developing world. This is yet another example of Cuba's commitment to medical internationalism. Over the past year alone, Cuba has sent 3,700 health workers in 52 international medical brigades to 39 countries overwhelmed by the pandemic. Cuba's international medical brigades have treated patients and saved lives for the past 15 years in 53 countries, confronting natural disasters and serious epidemics such as Ebola in West Africa. Once again, Cuba is leading the way. And at this difficult time, while Cuba needs us, perhaps more importantly, I'd say the world needs Cuba. And that's why we continue to stand in solidarity with her and to push back against the blockade, and why we continue to travel to Cuba to see the reality for ourselves and to counter the massive misinformation campaign about Cuba. That's why we've organized our caravan year after year and have pledged to do so until the blockade is lifted. Initially this year, we had wanted to go in July as usual, but given the limited flights to Cuba and the state of the virus on the island, we knew we needed more time to organize a safe caravan. So now, after preliminary discussions with our Cuban counterparts, we're hoping to travel down this November, and we encourage you to join us on this historic 31st Friendshipment Caravan. Traditionally, we've gone through Mexico or Canada, and we would do so proudly without asking for or accepting a US government license to do so. But every year, the extraterritorial reach of the blockade deepens. Now, all Canadian and Mexican airlines who fly to Cuba will not allow a US citizen on board without us signing that we are accepting a US government license. That means permission to go and stand and be in solidarity with our Cuban family. Regrettably, this year, we've decided that we will go through the US because the important thing is to get to Cuba. That's what we've determined with our Cuban counterparts. Due to all of the extra COVID issues around international airline travel, we think that flying direct from the US is the proper thing to do this year. We'll fly from and have our mandatory 2-day orientation in Miami. This is not just a practical financial choice, but also a political choice. And ideally, we will be part of a car caravan. There have been many of these car caravans, I'm sure that you've all heard about in various parts of the world and various parts of the US. We hope to participate in the one in Miami protesting US policy against Cuba if we can get the timing right. And we'll fly to Havana. We'll have an 11-day program there. We'll be staying at the Martin Luther King Center in a working class neighborhood of Marianao. We'll be visiting with the neighboring provinces, getting a chance to see some of rural Cuba and learning about Cuba, visiting with the CDRs, essentially the block clubs in Cuba, hearing about the work of the unions and the elected officials, learning about how they conduct elections, visiting houses of worship, combating the lies about no religious freedom in Cuba. And we'll learn more about the valiant work that Cuba has done on the national and international level in the fight against COVID. And if schedules allow, we'll be able to meet with some of the elected officials ideally also President Diaz-Canel, who said he would like to meet us. We just witnessed another historic vote at the UN against the blockade. Once again, the majority of the world's nations stood with Cuba and expressed opposition to the bullying policies of the US. Once again, Cuba stood isolated. I'm sorry, the United States stood isolated in its blockade policy. Despite these the vicious attacks against Cuba, it's remarkable to witness Cuba's resilience. This scenario, had it played out anywhere else in the world, would have resulted in a complete unrest. The solidarity movement is prepared to stand with the Cuban family and to push the envelope to bring down the blockade. And we're committed to continue this work until that blockade is ended. And we're convinced that together we will win. I'm grateful to our host for providing this opportunity to talk about the work of IFCO Pastors for Peace, and look forward to talking more and perhaps during the Q&A about ways that we can work together. There are a variety of different ways you can continue to support this work. So I'm going to ask, as Dr. Adri, I guess, will be speaking further, but perhaps after she has spoken, I can talk about briefly, very briefly, the ways that you can continue to help us do the work that we're doing and to support this effort. Thank you so much. Thank you for this time, and looking forward to working together as we continue this valiant fight against the US government's blockade of Cuba. Thank you so much.
Wow. Uhuru, Gail, I just really want to appreciate you for that dynamic presentation. And there really is no doubt that anybody who cares about the basic human rights to healthcare, especially those hardest hit, should be a friend of Cuba, because as you stated, Cuba is a friend to the world. From the pesquisas, the community health surveys, the vaccine development, the medical school, the caravans, all these ways in which offering the basic right for folks to have education that can directly impact their community. I think this is such a positive response to the genocide from the US blockade. No matter who's in power, it's an assault on the people, and really want to salute Cuba's goal to continue to be a self-determined people and bounce back, like you said, and in solidarity. And I really want to salute you for your leadership, Gail. So thank you so much for that presentation.
Thank you so much. Thank you.
Uhuru. All right, well, we have our next presenter. Next, we have Dr. Samira Adri, and I will give a brief bio here. Samira Mifatu Adri is a 2020 graduate of the Latin American School of Medicine in Cuba, also known as ILAM. She was born and raised in Accra, Ghana, before migrating to the United States at the age of 9 with her family. After completing her certification for nursing assistance, during high school, she further challenged herself to pursue the tools necessary to clinically uproot, quote, clinically uproot the gems of rot produced by imperialism, end quote, as charged by Frantz Fanon. Being an active participant and leader in the student government and social justice initiatives, tackling race relations, health literacy, cultural awareness, climate justice, and universal human rights, she was able to nourish and groom a variety of passions during her undergraduate studies in psychology at Fisk University in Nashville, Tennessee. She credits her parents for driving a thirst for knowledge and the conviction to selflessly serve her immediate and global community. She believes in health as a human right and fulfilling the ethos of Cuban societal values such as solidarity, altruism, humanitarianism through medical diplomacy. She currently is working at IFCO Pastors for Peace as the ELAM Scholarship Program Coordinator, while completing the necessary requirements to apply for medical residency in the United States. Her field of interest include, but are not limited to, the rural community medicine, preventative medicine, and cultural psychiatry. Wow, we welcome you to our program, and we're grateful to have you, Dr. Adri. Uhuru.
Uhuru, you read my full life. I wasn't expecting. Yes. Thank you, Comrade Michelle. Greetings, everyone. An excellent presentation by our leader, Comrade Gail. She has laid out a lot about the work that IFCO Pastors for Peace has been involved in, but specifically about the the important presence of Cuba in world history. So I don't want to repeat a lot of the things that she said, but I think what is very relevant to our community as Africans is that we must realize that internationalism is the key right now in every struggle. And our support of Cuba in its fight against this oppressive United States government is very relevant to all of us in every corner of the world. And it goes in the traditions of our forefathers and mothers. And we must understand that internationalism and making somebody else's problem our problem is exactly what Malcolm X said, what W.E.B. Du Bois wanted, what Chairman O'Malley wanted, what Jose Marti wanted when he said patria es humanidad. That means the whole world, the whole world, all of humanity is our homeland. And that's where the barriers that we have put up must be broken. So it leads us to the very critical point of how Cuba came to this point of being the giant that it is in healthcare, being the giant that it is in human rights. This discussion, especially in this past week, on June 23rd, there was the UN vote where the world resoundingly supported Cuba and made it clear that the US government should stop this blockade. And the question of human rights was thrown on the table as if to say that Cuba has not been respectful of human rights. And even the question of human rights, for it to be laid out by the United States, is very laughable. We all know this. And it's because they play on the fact that we have a historical amnesia, but we cannot allow that to happen. You know, human rights was first proclaimed by the Mandan Charter, by the Keita Empire. And so that predated Magna Carta. And yet we sit here and we think that the Western world has a right to criticize the rest of us about human rights. And Cuba has been fighting for human rights in every corner of the world for all the African people. And so that is why we cannot allow the truth to be altered. We must stand behind her and continue to push for her self-determination and her sovereignty to be respected. And that it has been unimaginable to be somebody who has reaped the benefits of studying there for 7 years and to learn and live with people who are so resilient and who understand what it is to know who you are and to defend who you are. Cuba today is able to boast of 5 vaccine candidates for COVID-19, 5. And within those 5, 2 of them have reached an efficacy rate that is just unparalleled. Abdallah, the vaccine, Abdallah just hit 92.28% efficacy. And it's even going higher. The numbers are going higher. It's going to be placed at number 3 on the world list of vaccines. Soberana Dos is also going to be up there. We don't have the exact numbers yet, but its efficacy is going to be unmatched as well. And then there's another vaccine candidate, Soberana Plus, that's specifically made for those who have had COVID before, so that they would be protected. Their immune systems will be protected from reinfection. And so Cuba continues to fight. Today, yes, unfortunately, the numbers are really high for the island. The island has been struggling since the beginning of this year with high numbers of infection, but at the same rate, as Comrade Gail mentioned, high number of recovery, high percentage of recovery. The infection rate has been going up. As we all understand, there are so many different variants that are forming right now, and the transmissibility is going higher and higher. But Cuba has never let down. It has followed strict measures from day one. It continues to educate its population every single day with a press conference led by its head chief epidemiologist, Dr. Duran. And it's incredible to see how transparent Cuba has been with its people from the time this pandemic started, and continues to answer questions, to guide its people, to help its people understand what the world is going through, what they're also going through. And this comes under the brutal blow of this blockade that is hitting them every single day, and has been for over 60 years. It's a pain, it's a struggle that a lot of us have underestimated, because we don't understand the war tactics that have been unleashed upon Cuba during this time. The war tactics that have been unleashed upon this tiny island, for the sake of destabilizing it. And for somebody who originated from a country that has been destabilized by the United States government, I don't take it lightly. This is an ongoing struggle of any people that wants to express its self-determination. We get plastered, but Cuba has been an example of resilience, that no, you can do whatever you want, United States government, but we will come back, and we will come back bigger and better. And that's why the success of their vaccines right now is a hope for the whole world, because so many developing countries cannot afford what Big Pharma has produced in terms of these vaccines. But Cuba, even before it reached its efficacy rates now, was promising to help those that it can help. That is the spirit of Ubuntu, that of understanding that I am because we are. And Cubans have understood this for a long time. It is time for our people, all Africans around the world, to rally behind Cuba, especially now, for this brutal blockade to end. I don't want to go over time because I have a lot to say, and I could be here for all day. But I will leave time for questions. To the audience, please, I want to respect that we are all here on this wonderful Sunday. Please tell me, Comrade Michelle, if I still have a little bit more time, or I should just stop.
Yes. No, yes, you have time.
Okay.
Continue, Comrade.
Thank you. Okay. So it is important for me to outline the fact that ELAM, the Latin American School of Medicine, is a continuation of a long history of medical internationalism in Cuba, by Cuba. So what most of us don't know is that Cuba, even before, once it hit the ground running in terms of the triumph of the revolution in 1959, soon afterwards, in 1961, it sent its first medical personnel to Chile to help after a massive earthquake. And then after that, in 1963, it sent doctors to Algeria. And this was during Algeria's fight for independence. And the list has gone on and on since then. Every single year, Cuba has been sending medical personnel, teachers, and other professionals all over the world to assist other peoples in building, in community building, in building the infrastructure. And it's not disaster tourism. It's not to come and throw charity at you. It's really to stand in solidarity, to help you build, because they truly understand that everybody else's problems are their problems as well. That if any part of our body, if the whole world is considered one body, if any part of that body is ill, we are also susceptible to the same illness. And so Cuba has invested its resources, human resources, in helping the world. And it has gone from place to place. I mean, unimaginable in the time in 2014, when the Ebola crisis was happening and everybody was just standing still, waiting to see what would happen. Cuba already had its contingent ready to go to the countries that were struggling and to help. And they were there. They were there when nobody else wanted to go, when everybody else was afraid. This is the same thing that happened after the earthquake in Haiti and so many other instances. And so the Latin American School of Medicine, when it was initiated in 1999, was an extension of that same internationalism. It was the living example of how Cuba is invested in training the children, sons and daughters of all other nations to be able to go back and rebuild their medical infrastructure, go back and protect the health of their communities. And that offer was extended to U.S. citizens when after a series of events, but especially after a few members of the Congressional Black Caucus visited Cuba with the guidance and the guidance of IFCO in the year 2000. And there was a congressman from Mississippi who was just in awe of the system that he found, the health care system, and asked, how can his people from Mississippi Delta, some of the impoverished communities, also come to the Latin American School of Medicine and study for free on full scholarship. In true gracious fashion, Comandante Fidel Castro Ruz, months later, offered 500 scholarships to youths from disadvantaged and underrepresented communities in the United States. And IFCO Pastors for Peace was entrusted with administering these scholarships, and embarked on a process of recruiting and vetting candidates for this prestigious scholarship. Just imagine a full ride to study medicine. And for you, not with any strings attached, the commitment is for you to return to your community and serve and help build and protect the health of your community. That is what ELAM is about. And so since then, we as the United States have had the pleasure of having we've had 196 graduates so far, graduate from ELAM that are US citizens. And this coming year, we're gonna have 12 additional graduates. That's amazing. And these are young people of color who are, the percentage of women is more than men. And from just every corner of this country. And they are dedicated to serving the people, to putting people first and not profits. The system that is built here is not welcoming to us. It's not made for us, but we continue to fight when we come back to insert ourselves. And it's important for to know about organizations like APDEP and Project Ankh, because yes, service is our calling. We have to serve our people, Africans everywhere, and just our human family. And so our objectives are in line. And this scholarship is open to individuals as long as they're between the ages of 18 to 25, have no criminal background. They have completed college level sciences, specifically a full year of biology, general chemistry, organic chemistry, and physics with the lab components. And I'm forgetting something. And they're a US citizen. So that's the basic criteria. But of course, we want people who are committed to social justice, because that is key. You cannot just be a doctor of science. If you wanted to do that, you could study anywhere else. But if you want to study at the Latin American School of Medicine, where our motto is to be trained as doctors of science and conscience, médicos de ciencia y conciencia, you need to be able to understand the plight of our people and connect to that, and understand that your work is to help rid our people of these obstacles that have been placed in our path. So if you want more information, you want to request an application, please visit our website at www.ifconews.org. We'd be happy to send you an application. It is critical. People of color, we have to not just arm ourselves with education for the sake of the prosperity of our peoples, but we must arm ourselves with education for the sake of serving our people. And I'm just going to end there for right now. I also want to say that it is important that this year, the caravan must be the biggest ever. It must be the biggest ever. We must send as many people as we can to Cuba to stand in solidarity. Yes, it comes at quite a cost, but we must fundraise and we must go to Cuba. We must see for ourselves. We must feel the people. I don't know what it is, but for me to have come from Ghana to live in the United States and then go study in Cuba, I've seen the connection, the elements of this broad and long-standing history of pain and trauma that people have gone through. And what we must learn is what we will learn in Cuba, is to be resilient and fight back, that nobody has the right to tell us who and what we can be except ourselves. And that is what our ancestors have been fighting for. We must continue that fight. So remember, through dogged work, like Frederick Douglass said, we cannot wait for freedom, we must work for it. So uhuru, everyone.
Ooh, uhuru, Dr. Adjuri. Yeah, just want to really appreciate you for your presentation and just continuing to build this work, this important medical program. And as you said, internationalism is key, right? And as African internationalists, we unite with this, fully, as Chairman says, it is our responsibility to not only explain the world, but to change it. And you remind us of, the power to govern and be self-governed, and that it has to be in the hands of the people, the workers, right, who generate this wealth for these imperialist countries that impose these problems that we're trying to solve. And so I just really want to salute you for that. And I hope our viewers that are listening really consider the scholarship opportunity and, and support the caravan. You said 1999, which was not long ago, and to see how much, this program has done, this model works, simply put. And I really want to salute you, comrade, for your presentation and your work. Thank you. Yes.
Thank
you. All right. So if you are just joining our webinar today, our webinar is titled Africans United with Cuba, Confronting COVID-19 and the US Blockade. We are featuring presentations from medical professionals and organizers based in the US and around the world. And the primary goal of today's presentation is to discuss Cuba's success in fighting COVID-19, including the vaccine development that Dr. Adjuri just laid out, which is really phenomenal. And to continue to learn about the impacts of the US blockade against Cuba and these opportunities for Africans to respond positively by learning about opportunities to get involved in these important programs and projects for self-determination around health and healthcare. I want to encourage anybody who is participating in today's webinar to continue to add your questions to the chat. We will address them in our live Q&A following our next presentations. And today's webinar is also, we want to encourage folks to fundraise for Project Black Ankh, which is our emergency response and disaster preparedness program. This is the African nation's response to these imperialist imposed disasters that continue to impact our people around the world. You can support ABDIP by going to our website to make a donation or to join as a member, www.developmentforafrica.org/donate and www.developmentforafrica.org/membership. And there is also some information in the chat as well for our partners with IFCO and ELAM as well. So Uhuru, I want to thank everybody, and we're going to continue our presentations of this dynamic panel, Uhuru. And next we have Dr. Michelle Strongfields. So Dr. Michelle Strongfields, MD, is the director and founder of EM Science Education Group, devoted to ensuring the increased representation of youth of color in the sciences. She has more than 30 years experience as an educator, physician, and advocate for quality care, healthcare, and the elimination of health disparity. She has trained and worked in the US, Cuba, South America, Africa, and throughout the Caribbean. She is a professor of anatomy and physiology, a community health advocate, a health consultant, and she is a longtime associate of the Philadelphia Black Women's Health Alliance and the National Black Women's Health Imperative. As an active participant in the Imperative's longitudinal study of Black women's health in the United States, she has led the training of community health workers in the US and abroad, and served on the Health Committee also for the All African People's Development and Empowerment Project, led by her daughter, Dr. Aisha Fields. Dr. Michelle Strongfields is a wife, a proud mother of 4, and grandmother of 5. And Dr. Strongfields believes that good physical, mental, and spiritual health is a divine human right. We want to welcome you to our program, Dr. Strongfields. Thank you so much for being here. Uhuru.
Ooh, everybody, listen, I'm leaving this picture up. I want everyone to take a look at this woman. This is Henrietta Lacks. And if you're not familiar with her, she's probably responsible for a lot of the therapeutics that exist for things like cancer or chronic disease. This woman is one of the reasons that I'm here today. The things that happened to her continue to happen to African people all over in this country. And I honestly, I didn't want to come behind Samira because she was so impassioned and she expressed pretty much everything that I wanted to say today. So thankfully they gave me a simple task, and that is to talk about how my observation and admittedly limited interaction with the Cuban healthcare system impacted me personally, and what I think are the takeaways for us to take a look at the system and see how we can take the lessons and apply them. This is practical application. I wanted to mention something that Samira said that really, Dr. Adri said that really impacted me. It hit me in my soul. And it's like when she said Ubuntu, I am because you are. And that is one of the tenets, whether they use Ubuntu or use some other way of expressing it, that is one of the, that is the overarching thing that I took away from my time with the Cuban health care system. There are three words that I'm going to use that I brought back with me. I knew of them earlier, but I brought them back with me after my experience there, and that is community health work. You heard on the film, the students, and my Spanish is terrible, but pesquisar, that is kind of loosely translated to mean community health work, and that is, for me, the greatest lesson for me to carry from my lessons learned, my many lessons learned in my time in Cuba. Briefly, a definition of a community health worker is a trusted member of the community who empowers their peers by providing educational connections to health and social resources. And I got that from MPH Salud. That is the first thing a medical student in Cuba will do, is spend some time in the community and learn. You heard the student say in the film, and know who his or her patients are. And that is important for many reasons. I think if you've ever visited an office and had 5 minutes and got rushed through, somebody flipped through a chart and looked and barely recognized your name, how in the world is this person going to be invested in helping you have optimal health? Won't happen. There are other names for community health workers. They're called community health advisors, lay health advocates, promoteras, outreach educators, and on and on. But the underlying message is, well, first, let me share a part of my personal journey and why I decided to model much of what my work in this country is based on my time in Cuba, and why I think it's so transferable and something that Africans can replicate wherever they find themselves, wherever communities are. While the US is often very boastful about the amount of money that the system has, and when they talk about the amount of money and how really rich this medical system is, they're talking about machinery or talking about testing capabilities or research. But there are many indices, health indices in this country. And when I say health indices, when you take a look, take a snapshot at a community and see just how well or how ill they are. Very often, this country in specific communities lags behind what they disrespectfully call a developing country. Let me give you an example. I was a poor, working mother. I lived in a part of town in the city where I lived that boasted world-class hospitals and universities. This neighborhood also is one of the most populated, has the highest population of people of color in it, in this whole city. This neighborhood also had and still has the highest maternal and infant mortality rate in the city and in many of its adjacent states. It is shameful. This is a world-class hospital up the street that also has one of the highest infant mortality rates and infant and maternal mortality rates in the city. If you remember a few years ago, Serena Williams, the world-class athlete and all-around icon for some, who could really very easily afford any kind of health care that she chose, had to very aggressively defend her own life following childbirth because the caregivers there just didn't give much credence to this Black woman's report that she was ill or she didn't feel well. She knew her body. This is an athlete who trains. So if Serena Williams is dealing with this kind of disregard and blasé attitude toward her health, which was turned out a life-threatening situation, imagine what poor Black men and women who go to seek health care face. They don't have advocates, they don't have cash. The lack of access, misdiagnosis, mistreatment, and the indifference to Black pain has been and remains in place. The problems here are systemic, beginning with the very well-documented miseducation of US med students. And that is with regard to implicit and explicit bias. I've been dealing with this system a long time. If I don't go and advocate, if I don't say I'm Dr. Strongfield, I go to an office and see someone, I wait and observe to see what kind of treatment. This medical education system has to be impacted. You are trained to be an ethical purveyor of healthcare in Cuba. That was one of the things that struck me so. Students are taken to their patients. There's a community, I can't remember the name of it. There's a community doctor who treats a neighborhood. Everybody, as the student said earlier, everybody knows this doctor. Everybody can access this patient, but this physician. But the other thing is, there's a concerted effort to teach and share information. Like, you are invested in keeping yourself well. That's something I want to transfer here. And so I've done some things, and I'm sure you guys all will have developed some strategies. But part of my strategy is to develop cohorts, to develop, starting with young children, which is why I developed I Am Science, which is an organization, which is a nonprofit, to work with young children and not make science mysterious. You are the first scientist. So you develop a group of primary school children, and then it moves up to the high school kids, which we do another set of programs. And I learned this because I watched and observed Cuban folks all over. My cab driver knew. I was asking him some questions about, he was bandaged. This is when I was rolling through Havana. He was telling me all about his illness because his physician had taken the time to educate him about what it was that was his problem. We can do that here. We should do it here. Africans, it's imperative that we do it. Samira got me all impassioned, and so I'm trying to find a way to end this quickly so you guys can move on to the next section of this. But I'd like to open up myself for a question and answer period. I'd like to answer any questions. I know I probably left lots of gaps in information, but my takeaway is that there is a way for us to approach medicine in this country that I've observed there that I'd like to transform and develop here. And organizations like Black Onc will give me the opportunity to do that. It'll let me remove, and it'll let anybody who's interested in healthcare remove the thought from practitioners that health is a commodity that you buy and sell. Health is a right. And through the work, and I'm happy to be collaborating with all, and I'm happy to see IFCO and APDEP collaborate. I appreciate you giving me this time to chat, and I hope that we can speak again in greater detail. Have a good afternoon, everybody.
Dr. Strongfields, really want to just thank you for that presentation, and especially just taking the time to give our viewers an opportunity to understand the details that go into community health work, and especially how we can advocate to build this work with the skills that we already have, like you said, as health workers, community workers, organizers, and so on. And I appreciate what you said at the end about the call for us to see health as a right. And just as you showed Henrietta Lacks's image, I can only imagine that others who are watching this too are also seeing continued examples of what this work looks like. So I want to salute you, Dr. Strongfields, for your presentation. And yes, we look forward to questions and answers coming up soon. So lastly, I'm excited to introduce our last presentation, which will have two panelists, Dr. Aisha Fields and Dr. Loretta King. So Dr. Aisha Fields is an applied optical physicist and in the international director of the All African Peoples Development and Empowerment Project, also known as APDEP, which is a nonprofit development organization founded by the Uhuru movement in 2007. As the APDEP director, Aisha is responsible for coordinating African community-led healthcare, agricultural, and educational programs on the continent of Africa and in African communities worldwide. Under her leadership, APDEP has built clean water systems, vocational and nursery schools, community farms, maternal centers, and a variety of youth and adult education programs. Currently, Dr. Fields serves as the chair of the International COVID-19 Telehealth Program of APDEP's Project Black Onc, and is coordinating the development of medical teams in the US and Africa, along with on the ground, with online outreach aimed at providing the Black community with information about medical care during this time, which continues as a global pandemic. Dr. Aisha has led many programs in Sierra Leone, West Africa, and the APDEP medical team has been trained as community health workers to prevent on the identification of waterborne illnesses and diseases such as Ebola as well. She has also helped with the grave conditions of the existence that Africans face around the world and believes that sustainable development for Africa and African communities is possible, but only through self-reliance and self-determination. She is a proud mother of 3 beautiful children. We want to welcome you, Dr. Fields. And we also have included in this segment, Dr. Loretta King, who is an APDEP volunteer and also serves as our APDEP Medical Programs Coordinator for Project Black Onc, our COVID-19 telehealth program. Dr. Loretta King is a family nurse practitioner with a Doctor of Nursing Practice degree from Chapman University. With more than 30 years of nursing experience, Dr. King has worked in emergency care, ICU, dialysis, women's health, and primary care. She is a recipient of the 2005 Houston Salute to Nurses Award, and APDEP is incredibly appreciative of Dr. King's contributions to our medical advisory team committee, her support and her passion, and for taking up the responsibility to return her skills and her love to African people. So Uhuru, Dr. King, Uhuru, Dr. Aisha Fields, we are happy for your presentations today.
Uhuru, Comrade Michelle. I really want to appreciate you for that introduction. And I want to thank all of the presenters who have participated in this webinar so far. Sister Gail Walker, the IFCO director, Sister Dr. Samira Adri, and my mother and comrade director, Dr. Michelle Strongfields. And as everybody knows, the title of this webinar is Africans United with Cuba, Confronting COVID-19 and the US Blockade. And I think it's important for me to state from the very beginning of this presentation that a central purpose of this webinar is to declare our unity, and that is the unity of APDEP and the wider Uhuru movement with the revolutionary people and government of Cuba.
As the APDEP director, I sit on the National Central Committee for the African People's Socialist Party. And our party was founded in 1972, led by our chairman, Omali Yeshitela. And we are an international organization existing in the United States, in Europe, in Africa, and the Caribbean, and with mass organizations and economic institutions around the world. The African People's Socialist Party is the advanced attachment of the African working class. We've been organized to pursue the goal of liberation and unification of Africa and African people under the leadership of the African working class as a critical component of the struggle to overthrow imperialism and all of its representations and manifestations, including all forms of colonialism, and the establishment of the international dictatorship of the working class. Our theory, African internationalism, is a theory that explains the world, as well as the place and future of Africans in it. African internationalism recognizes that capitalism, born as a world economy, has its origin in the assault on Africa and the global trade in African captives, as well as the ensuing European onslaught on most of the world. Our party, having assumed the tremendous task to be accomplices of history in this great battle between the past and the future, for a future free of oppression and a world where a few do not live at the expense of the vast majority of the world's people, salute and unite with the goals and the tremendous gains, the obvious victories of the Cuban Revolution. We unite with Comrade Comandante Fidel Castro when he said, "I find capitalism repugnant. It is filthy, it is gross, it is alienating because it causes war, hypocrisy, and competition." We recognize that what we are looking at in Africa and throughout the African world, when we see the extreme poverty, the violence, and the misery that our people experience, is the result of colonial capitalism. It is the imposition in many instances of neo-colonial rule on our people. We are looking at the effects of the defeat of the Black Power Revolution of the 1960s. We are looking at the effects of the murder and political overthrow of genuine African revolutionaries like Kwame Nkrumah, Patrice Lumumba, and others who were working to unite Africa and use the tremendous resources, both human and material, for the benefit of the masses of African working people. What we are looking at now is the evidence of the fact that we still have much work to do, that we must unite the African nation and forward the African Revolution that will, like the Cuban Revolution, ensure that we can harness our skills and the vast resources towards the benefit of our society and of humanity as a whole. We acknowledge and appreciate the solidarity that the revolutionary Cuban government and people and leadership have historically and presently shown to African people. And we know that the primary reason why the Cuban people may suffer today is because our common enemy, indeed the enemy of all humanity, white power, imperialism, has not yet been defeated. The colonial capitalist world economy still sets the terms for all economic activity worldwide. And for now, the capitalists still have the capacity to enforce the illegal, immoral economic blockade as a form of warfare against the Cuban people. But our chairman, Omali Yeshitela, has helped us to understand that imperialism is in deep crisis, that there exists an uneasy equilibrium between the past and the future, and that a new world is not only necessary, but possible, and that the African Revolution must play a key role in wiping colonial capitalism off of the planet. Having said that, I want to really appreciate all that we've already learned today about what Cuba has been able to do to safeguard its people and show solidarity to others during this period of the COVID-19 pandemic. The Cuban example serves as an incredible inspiration for APDEP as we work to build our own independent systems of health for African people. So what I'd like to do now, and if Chiwo can help me pull up the presentation, is I'd like to give a general overview of APDEP's work, where we've been, and kind of where we're headed. So we can go to the next slide, please, Chiwo. So just to say that APDEP is a nonprofit organization established by the African People's Socialist Party in 2007. We're one of many international organizations and institutions of the Uhuru movement. Next slide, please. Our mission is to collectivize the vast skills of Africans around the world in order to establish community-based development projects that improve the quality of life for African people everywhere, while promoting self-reliance and self-determination as key to genuine sustainable development. Next slide. And our chairman, the chairman of the African People's Socialist Party, Omali Yeshitela, he reminds us that APDEP is an important African internationalist organization that opens the door to the struggle for African liberation to an often overlooked sector of the African population: doctors, nurses, engineers, and other skilled African workers. A part of APDEP's task is to influence, indeed induce class suicide when possible, or at minimum, harness their technical expertise to the anti-colonial interests of the African nation as defined by its advanced attachment, the African People's Socialist Party, the vanguard of the African working class. Next slide. So APDEP has several principles of unity, and this is what people who want to join APDEP or volunteer with APDEP have to unite with. People don't necessarily have to be socialists or consider themselves to be revolutionaries, but if they unite with these basic principles of unity, then there's the basis for us to work together. So all who participate in APDEP work must do so under the leadership of APDEP in order to meet our organization's goals and objectives. All African people, wherever we may be located, are one people. The resources of Africa are the birthright of African people everywhere. African people need self-determination, not charity. And finally, I really appreciate Dr. Adjue and also Dr. Strongfields for raising this issue, which is a big, one of the primary things that APDEP takes into the world, and that is that any skill possessed by any African anywhere around the world does not belong to that individual African, but that skill belongs to and must be used for the benefit of the masses of African people everywhere. Next slide, please. So APDEP focuses in 4 main areas: healthcare, education, agriculture, and humanitarian aid and emergency response. Next slide. So I wanted to start just by saying something briefly about the history of some of our healthcare work. I don't know if you can see it that well, but the person standing is actually Dr. Strongfields, who just presented. This was at our very first APDEP initiated healthcare program in Sierra Leone in 2008. We were formed in 2007, November. By January, we had sent a contingent of APDEP members to Sierra Leone to do an assessment of the kind of issues that people were experiencing on the ground, and to see what kind of programs we might initiate in Sierra Leone. By February or March, we had sent Dr. Strongfields, who is a longtime, obviously, volunteer of APDEP, to Sierra Leone to lead our first project, which was a community health workers training, where we trained 50 members of the community on the prevention, identification, and treatment of waterborne diseases. And as many people may know, waterborne diseases are a major killer throughout Africa, where most of our people do not have access to clean water, but there are simple ways in which people can be able to deal with waterborne diseases and not have to die usually from the dehydration or diarrhea that's associated with drinking bad water. So this was our first project, and I really want to salute and appreciate Dr. Strongfields for leading our initial healthcare programs of APDEP. Next slide, please. So over the years, APDEP has engaged in a number of healthcare programs. One of our, I think, most important was our infant and maternal healthcare program in Sierra Leone, where we, at that time, the sister who was leading our work was a nurse midwife, a very talented nurse midwife, who we helped to get some additional training in the United States on some of the complications that that women were experiencing in delivery in Sierra Leone. And when she returned to Sierra Leone, we helped to develop a network of nurses and hundreds of traditional birth attendants to be able to offer additional training to all of them, and also to set up a network where, let's say a woman was giving birth with the assistance of a traditional birth attendant. Then the sister who, the traditional birth attendant might be able to recognize, okay, this is a situation that is beyond what I can handle. Maybe there's some kind of complication. At that point, through our network, that sister would be brought to one of our maternal centers From there, she would either deliver with the assistance of our nurses and midwives, or if it was a case that requires something like a cesarean, we would coordinate the transportation to a hospital that could perform the cesarean. So through that process and through that network of coordination of traditional birth attendants, nurses and nurse midwives, APDEP helped to deliver more than 3,000 babies without death of one mother or child. And this is at a time when something like 1 in 10 women were at risk of dying in childbirth in that country. So if we can go to the next slide, please. So these are just some more pictures of some of the nurses and traditional birth attendants connected to our APDEP infant and maternal health program in front of one of our clinics in Sierra Leone. You can go to the next slide, please. And this was from a trip that I'd taken to Sierra Leone in 2013. These are some of the babies who had been delivered in our clinic. I attended our clinic during clinic day and had an opportunity to see some of the babies who were coming to be seen at the clinic who had been delivered at our center. Next slide, please. So also on the question of health, we have initiated under the leadership of our moderator, Comrade Michelle Odom, who is also our mental health programs coordinator, something we call our AYA resistance circles. These are spaces where we give African people an opportunity to deal with the mental and emotional stress and pain associated with being colonized people, but that we see this through the lens of African internationalism, which helps us to understand the source of that pain as being the colonialism, as being the constant oppression that African people experience, and recognizing that we have a responsibility to be in the best mental and emotional space possible so that we can contribute to the fight back against colonialism. So these circles have been something that have been really well received, and we're looking forward to expanding the work that we do with these AYA resistance circles. Next slide, please. We also have initiated something called our Ask the Doctor series, which this is a part of, which invites African medical professionals, mental health workers to share their insights with the global African community. This one is a flyer of one that we did back in April with some really powerful guests, including Dr. Ngozi Krushan, a psychologist. We dealt with the question of collective mourning and organized resistance. Can we go to the next slide? So on the education front, one of our oldest programs is our Marcus Garvey Youth Program, which was initially started in Washington, D.C., and now exists as an international program that offers African children access to African history, culture, survival skills, and other practical kinds of skills that we typically don't have access to in the colonial education system. If you can go to the next slide, please. One of the programs associated with our Marcus Garvey Youth Program is our annual Black History Essay Contest. These are some of the winners of our 2021 Black History Essay Contest, which asked the question, who is your favorite African revolutionary and why? We had entries from around the world, children from Sierra Leone, from Nigeria, from Senegal, from the United States, who participated in this Marcus Garvey Youth Program Essay Contest. Next slide. On the agricultural front, we have done a lot of work to build community gardens and farms. This is a picture of one of our oldest community gardens, which is our Gwynn Archie Community Garden in Houston, Texas, where we just finished having, I think, our 7th annual Juneteenth celebration. We approach the questions of community gardens as a way to be able to deal with the health of African people, as a way to bust up these food deserts that have been imposed on African communities, and as organizing spaces, places where we can not only work together and share skills, but where we can get organized and we can work together to forward the work that will liberate Africa and African people. Next slide, please. These are some pictures from one of our community gardens. I think this is our community garden in Houston also. Next slide, please. One of the things that we've initiated is a process where we're organizing with churches to build community gardens, to be a part of an APDEP agricultural community garden network of sorts. So where I live in Huntsville, Alabama, we've initiated this process with our first church partnership, which is St. Bartley Primitive Baptist Church here in Huntsville, where we have helped to develop our first, like I said, church community garden network, and we're looking forward to mobilizing with other and organizing with other churches to be able to develop on the land that usually many churches, especially in the South, have access to, so that we can feed our community, and so that we can again use these gardens as organizing spaces where we can get our people involved in the work that that we need to do to be able to overcome colonialism. Next slide, please. We also have our own economic institution, which in August will celebrate 5 years. It's called Zenzele Consignment. We're an African clothing store. We sell African clothing, jewelry, accessories, personal care products. We're a consignment store where people, tailors and designers and people who make their own products can sell their items through our store, making resources for themselves, for their families, and also helping to support our programs. We're also a cultural and political hub of the African community here in Huntsville. We're the place where people go to have conversations about how the police, are killing folks in our community, where we can find access to these important programs, and where African people can experience our culture and become, organized. Next slide, please. So in a moment, I'm going to bring up my comrade, Dr. Loretta King, to talk about our international COVID-19 telehealth program. But first, I want to say something about our project Black Ankh, which is the program that was developed as the African nation's response to the Red Cross. This is our emergency response disaster preparedness organization. And we decided to establish this program in 2014 in response to the Ebola epidemic that hit West Africa. At that time, APDEP had many programs, not only our maternal centers, but we had vocational school, nursery school, community farms and gardens. And when Ebola hit, we had no capacity to be able to provide direct care. But we knew that there was something we needed to do and we had to do. And that was where we began to birth Project Black Ankh. Next slide, please. So if we can go to the next slide, please. You can go to the next one too. I'm gonna speed up just a little bit. So part of what we initiated through Project Black Ankh was we went back to the concept of community health workers training. So we developed a process where where we trained 50 community health workers on the prevention and identification of Ebola virus disease. And where we connected with, if you can go to the next slide, we connected with 40 Ebola survivors and their families, providing them with food, water, medicine, sanitation supplies. And we also connected with community entertainers, singers, performers, and helped to develop jingles that these performers would go and take out into community spaces, marketplaces, and other places to raise up Ebola survivors and their families as heroes, to try to deal with the stigma associated with Ebola survivors returning home. Next slide. So in the period of COVID-19, we reactivated Project Black Ankh. We had done some other things after Ebola, responding to Hurricane Harvey in African communities in Texas. But it wasn't until this pandemic hit that we recognized that we had to create Project Black Ankh as a permanent program. So our party initiated something that we call the People's Campaign, People's War Commission Against COVID-19, that I have the responsibility as APDEP's director for leading. We assembled our medical advisory team, which includes Dr. Loretta King, who you'll hear from in a moment. And we began immediately developing protocols for how our community could minimize our risk of getting COVID-19, how we could boost our immune systems, ways that we could deal with the issue of quarantine. This was before the US government even did the lockdowns. This was before there was discussion about the need to wear masks. Our medical advisory team was taking the need for mask wearing, the need for basic kinds of protocols and things that we could do to minimize our risk. We put them into popular leaflets, brochures, flyers, posters, and we took them by the thousands throughout this country and in South Africa into African working class communities. And here you see some of our organizers throughout this country distributing those materials. Next slide. Next thing we decided to do was we had to develop a program. And I want to bring up Dr. Loretta King, who is our medical programs coordinator, to talk to us a little bit about our international COVID-19 telehealth program that was developed last July as our programmatic response to the COVID-19 pandemic. Uhuru, Dr. King.
Uruhu, Dr. Fields. Thank you for that wonderful presentation or introduction. I am very honored to be on this panel today. The presentations were phenomenal, and it's such so passionate to hear women very compassionate about the work that we do, the work that we do and that we're going to continue to do. So thank you guys so much. All right, so I would like to give a presentation about the International COVID-19 Telehealth Program, but I would like to start off by introducing some of the people who work with me, members of the program. So it'll be Conrad, Deborah Fofi Akibalan. She's an RN with more than 40 years of experience in the field. She's based in St. Louis, Missouri, and she serves as our medical volunteer coordinator. Dr. Lauren Arrington, she's a nurse midwife in Maryland, and she's a longtime ADEPT supporter and volunteers her services as one of the providers for our telehealth program as well. And then there's Adonica Franklin, Dr. Adonica Franklin. She's a nurse practitioner, and she's based in Houston, Texas, and she also serves as a telehealth program provider. ADEPT launched our telehealth program in July of 2020 in response to the call from the African People's Socialist Party, People's War Commission for ADEPT, to reignite Project Black Ankh and build our own independent healthcare programs that meets the needs of our people during this pandemic. For those who may not be familiar with the term telehealth, it's defined as the use of electronic information and telecommunication technologies to support long-distance clinical health care, patient and professional health-related education, public and health administration. In short, telehealth gives healthcare providers and educators a way to serve people's healthcare needs remotely without having to meet in person. Because of the COVID-19 and how it spread, the need for people to physically distance, telehealth has become a major way in which people access care in the US and in other countries that have the technology infrastructure. ADEPT built our telehealth program in order to make a positive impact on the lives and the health of African people around the world by providing access to COVID-19 related information and education provided by our medical volunteers through educational guidelines from the Center of Disease Control and the World Health Organization. All appointments are free and are staffed by our licensed medical professionals like myself. However, our telehealth program does not offer our users access to medical treatment, and we stress, and I mean we stress the importance of collaborating with the primary care provider for ongoing care. If you have COVID-19 related symptoms or questions, you can make a free virtual appointment by going to our website, www.developmentforafrica.org/telehealth. All our appointments are in 30-minute time slots via Zoom call. Please note that appointments time are in US time zones. For now, appointments can only be taken in English. However, we're working on a plan that will hopefully allow us to appointments in other languages in the future. Since we began taking appointments, our telehealth program has provided educational resources and guidelines to African people around the world. To date, we have taken appointments from Sierra Leone, South Africa, the UK, France, and several states here in the US. What does the future for Black telehealth program looks like? Well, for me, I think it looks very promising. Because of the success we've had so far with providing information about COVID-19, Our goal for the future is to expand our program to provide health information on diseases that are prevalent in our communities, such as diabetes, hypertension, hyperlipidemia, strokes, and heart disease, just to name a few. We're working now to include mental health support as our next addition to the program. We are certain that the more our people know, the better our health outcomes will be. I would like to thank you for this presentation, and I'm going to turn it back over to our moderator, Ruhu Michelle. Thank you.
Uhuru. Thank you, Dr. King. Before we get it back to Michelle, we're just going to show one more slide, I think 1 or 2 more slides. Could you bring up the presentation one more time? Thank you so much, Dr. King. And I just want to say that APDEP is really inspired, very inspired by the powerful life-saving work of the Cuban Henry Reeve Brigades. And I don't know, Chivo, if you can pull that slide up for me, please. As she's working on that, I'll just keep going. We're really inspired by the Cuban Henry Reeve Brigades. And we acknowledge the medical support that Comrade President Fidel Castro offered in response to Hurricane Katrina. We remember that. We remember that offer. And we also remember the fact that medical support was absolutely needed, but it was quickly rejected by the US government, the same US government that allowed African people to drown in the rising floodwaters. APDEP recognizes that we have the responsibility to further develop Project Black Ankh to include our own African-led emergency medical response teams that can be deployed in African communities in the US, in Africa, and around the world when natural disasters or other emergencies impact African people. We are excited to have a contingent of APDEP's medical forces to travel with IFCO this year as part of their annual caravan to Cuba, so that we can learn more about how Cuba has been able to safeguard its people during this period of COVID-19, and to hopefully establish relationships that can help us to establish the training that would help in this process of developing our APDEP medical response teams. I look forward to developing a deeper relationship with IFCO and its Cuban solidarity work. And I again salute the revolutionary Cuban people and government. And I say, Viva Cuba, long live the African Revolution, venceremos. Uhuru.
Yes. Wow, Uhuru. Really want to just appreciate Dr. Fields and Dr. Loretta King for these presentations, and again, your tremendous leadership and volunteering our skills back. I'm a proud member of APDEP for all of the reasons that you shared, and I never get tired of watching that presentation to really be inspired by the work. And I want to salute your solidarity statement for our comrades in Cuba for the work, because this is what internationalism is about. And I just want to again salute us hitting all areas of the lives of those who are most impacted. So thank you, Dr. Fields and Dr. King, for that presentation. And I know we are ready for question and answer. And I want to continue to encourage folks to continue to put in your questions, comments, because we're going to move forward into that right now. So again, thank you all of our panelists for such an inspiring, dynamic presentation. And it's really clear that you all continue to lead the way forward and are just positive examples of what power looks like when it's in our hands. So I want to let anyone know who's watching again, who has interest in today's topic, to see the links in the chat with each organization's website and contact information. Again, all of our skills, no matter what your skills are, and your solidarity and your resources are essential to building these programs, these highly needed self-reliant programs, and taking up the responsibility for us to self-govern the matters that are related to our own health and the lives of our people. So again, we're going to open up for question and answers right now. And I do want to also allow any of our panelists who want to add anything or elaborate on anything in their presentation, even if it's just information for how people can get involved, please do so as well during this section. Okay, and maybe we can even offer that quickly. I don't know, Sister Gail, Director Gill, if you wanted to add anything, and if not, okay, perfect. I see you put it in the chat.
Sure, I just wanted to put in the chat. I had meant to mention earlier that we really do want to encourage folk to learn more about both the annual Friendshipment Caravan, but also the Latin America School of Medicine Scholarship Program. It's a tremendous opportunity for folk from our communities to really become Cuban trained physicians, and we're so desperately needed here in our community. So please go to the IFCO News website to learn more. We're, like all of us, grappling with trying to do fundraising. So we don't get government funding, as you can imagine. We don't get a lot of foundation funding. It's really grassroots funding that helps to keep us alive. So any opportunities to provide financial support is greatly appreciated. There's a donate now button on that website, ifconews.org, and we encourage folk to go there and to learn more about the work and ways you can support it. But thank you. And thank you for this whole presentation. It's outstanding information. A lot I want to follow up on. Dr. Aisha, we've got things to talk about. I'm excited about the caravan and you're participating and finding ways that we can continue to connect.
Thank you for that. Conews.org. Thank you, Gail Walker, for that. And I want to offer one of the questions that we have and also some comments too. Let me just start with a few comments. Again, we have a great presentation. The healthcare systems are only as good as they practice to be. Care for the people as you would care for yourself and the ones that you love. Someone else here, so just a lot of salute and just support for our for Gail, Dr. Samira, and our presenters from ABDEP, and our volunteers. And as well, we have another one here that says, this is from Dr. Adri, which I love. Kwame Nkrumah said, "Forward ever, backwards never. Thank you all for the love. Let's show our love for Cuba." So yes, Uhuru. So one of our questions here is from Matsamela Odom. Uhuru, Comrade Matsamela, it says here, can you talk about the vastly different rates of African medical students in Cuba versus the US? And I can repeat that question if needed. And this might be for all, well, specifically for our Cuban Medical School and IPCO. There we go.
Do you mind repeating the question?
No problem. So it says, can you talk about the vastly different rates of African medical students in Cuba versus the United States?
I think I'll take that. Okay.
Yes.
Thank you, Comrade Michelle, and thank you, Comrade Matsamela, for the question. The statistics to differentiate how many students or African medical students have studied in Cuba versus the United States, we don't have them cold. But I can tell you, for example, in the case of the Latin American School of Medicine, in these short 21 years, I have graduated over 30,000 physicians from all over the world. And that's representing over 120 countries, much of whom are from our African peoples from all over, because it's not just about the continent, it's African people from all over. Just imagine going to school with our comrades from Kiribati, Tuvalu, the Maldives Islands, Solomon Islands, places that some of us only read about in history books, saw photos, Runoko Rashidi highlighting African peoples from all over the world. And here you are in school with your comrades from the other side of the world. So we don't have cold hard numbers, but I can tell you that Cuba has been pouring its resources in training our people so that we can go back. Whereas the United States government has been trying to drain our people of the expertise that we have. Many of our people train in our own countries and then leave to come here or leave to go to other developed countries. That is not what Cuba is about. It trains us to be able to go back to our countries. And it's unfortunate that, we're so destabilized that some of our graduates still clamor to come back to these Western countries, but the majority of us do go back to our communities. The majority serve in our communities where it's needed. And we are always ready to go wherever it's needed. So we don't have cold hard numbers. I wish I had that for you, but please believe that Cuba has been in this battle, and it's way before Elam. It's been training people. The first African students, African children who were sent to Cuba were on the Isla de Juventud from Angola, I believe, and several other countries subsequently. Beautiful documentary that everybody should check out is the Orphans of Sankara. I think that's the correct translation because it's originally in French, and it's pretty recent. And there you don't see you see the story of 600 children, mainly orphaned, either having lost both parents or one parent, who were sent by Comrade Tomas Sankara to Cuba to train and go back to Burkina Faso and serve. And it was just over a year after he sent those 600 youths out there that he was brutally killed. But you know what? Cuba didn't send 600 kids back to Burkina Faso for Blaise Compaoré and his French government, French funded government to annihilate them. Comandante Fidel Castro kept those children in Cuba because he said those were his brother's children. Okay, that just makes my hair stand on end. Those were his brother's children, and he kept them in Cuba, trained them, many of whom continued their education into residency, gaining specialization, and then going back to Burkina Faso when it was time to go back. They didn't want to go back because they knew what they were going to meet was not the revolutionary Burkina Faso that they had left, but they knew the mission was real, that Thomas Sankara had told them to go back and build. And that is the same, it is the same message that Cuba has left the world with. That is just one example. That's just one example. And unfortunately, even though the infrastructure is not there for those graduates to do or fulfill the mission that they learn in Cuba, they continue. They continue to force their way through, to build brick by brick, because this dream was created before us, way before us, and we have to continue it because the world must be better. And it's just like Comandante Fidel said, a better world is possible, folks. A better world is possible. So we keep working at that, and I hope that answers your question, más o menos.
Wow.
Listen, I don't know why I always come behind Samira. She rose up the spot. She made me forget everything I wanted to say the last time. Okay, but I'm gonna push that aside. I'm a member of the medical advisory committee that look over applications. This is kind of in a tangential way responding to that question. One of the reasons I know that many US students, who train in the US, they're so burdened by debt. It is horrific, the kind of debt. Like I did 2 years in this country before I left and went to Cuba. I had already taken the USMLE and, so my situation was different, but just in the 2 years, the amount of debt that I accumulated, because I had a family, I was a non-traditional student. And so that may be one reason that students feel pressured. But when you go to school and you come back and you are debt-free, well, mostly, not totally, but because you have living expenses, etc. You can do some things. You can say, hey, I'm going to pursue trying to build a community health workers model here. Right. You can pursue those things. You can say, the students face additional challenges once they come back to try to practice here, as we've discussed in the committees. But one of the things that we do is we look at applicants they may not know everything. They may not have, a very well-rounded political education, but if they have the desire, if they demonstrate that they have this head that's able to look beyond the disinformation campaign that is unrelenting, that is comical almost, you know, that this tiny little island poses such a threat because they think in terms of us instead of me, you know, the whole concept of Ubuntu.
Right.
That it frightens for whatever reason, because capitalism is such a parasite. It can't even fathom the fact that there's a system that thinks collectively, you know, so they want to mislabel and, you know, and I'm not, and I don't have, you know, I'm not romanticizing in any way. I mean, every society has its issues and difficulties. But fundamentally, if you think of the people that you live with and serve, and if you think of it as the collective, if you think of, and the people themselves consider themselves a part of a group, that that everybody's well-being, which explains why Cubans are getting vaccinated, where you have to practically fight to get yourself on an airplane in this stupid place. People are just so ridiculous about their so-called freedoms that they're willing to make you sick, your mama sick, your grandmama sick, because it's their freedom. Rather than thinking collectively and saying, you know, maybe I don't necessarily want to get a vaccine, but I'm gonna wear my mask because it'll be protective. Come on. Yeah. So, okay, Samira, you made me feel all that passion that you were giving us. So I'm a step down. Let somebody else talk.
I just will super quickly say that, you know, I think that Cuba's commitment and connection and relationship with Africa has been, you know, historic. And I remember the first time I heard Fidel Castro say, you know, I have African blood running through my veins. And that just like blew me away to have, you know, a world leader who was like embracing his Africanness. And of course, we've seen example after example of where Cuba, we know the saying that, you know, Africa called, Cuba answered. And it's been shown over and over and over again. So there's a history there. And this scholarship program, as far as I'm concerned, is just an extension of that. And anybody who's ever had the opportunity to go to Elam and see these young Africans that are walking around the campus with their white coats, and they're out there, and they're our future. And this is thanks to this wonderful gift that Cuba has offered. So I'll leave it there.
Oh, wow. Thank you for those responses. And I just want to say something that I gathered from everything that everyone said, and something that we say in ABDEP specifically was that we don't lack skills, right? As people, what we lack is organization. And this is really the time for us to connect all of our skills for a common goal. And this is just a perfect example of us doing that right now here in this webinar, but also just the work that is happening beyond and that has been happening. So and one of the questions that just came in, Gail, you kind of hit it already with your addition, but I'll ask it anyways. And this question is saying, this is also from Comrade Matsamela from Facebook. Thank you, Comrade. It says, can you all talk about the other forms of Cuba's internationalist support for Africa and African people? So if you want to elaborate anything else, but just feel free to take up that time.
Yeah, I mean, part of what I was interested in hearing a little bit more about was the water purification program. There are different organizations that have, you know, done work with Cuba around water purification, and that's wonderful. But I would love to be able to have a clearer understanding about some of the work that Black Ankh has been engaged in, and to see if there's some natural linkages there. So that's sort of tangentially related, at least to what I was thinking.
May I say, I was, when I left Cuba, I went to Guyana, and I was working at the university there. And who was teaching in all the universities, not just as physicians, but, you know, working as academics, you know, and researchers and, you know, regular teachers, was a whole host of Cuban educators, etc. So they just don't do medicine and healthcare where there's a need, and Guyana was going through some political changes and upheaval at the time, because the U.S. had deported a giant number of, I don't even remember how many Guyanese. I can't remember what the reason was for. And so all of a sudden, there are all these people in Guyana, and they needed healthcare, they needed education. I mean, there was this big influx of people, and Cubans were there to help kind of fill the breach. So their role is much larger than healthcare. We know about it because it's the most visible thing, and they always step in when there's a huge crisis. I imagine if Ron DeSantis wasn't the governor of Florida, they might be there right now helping out with this terrible collapse that they had of the building. Just like, I'm sorry, but I always go back to when the school first opened, and there was this, what was that, Hurricane Mitch? What was that hurricane? I can't remember. But it had devastated Mississippi. It had devastated, which was a big rice producing part of the country. And so now all these farmers are wiped out, the healthcare is nothing. They made a simple offer. Look, we can send some people to help you. And the Bush administration, Bush shrub, not Bush the daddy, just turned it down. I wasn't even thinking about going to Cuba at that time, but that to me was just, it was like ridiculous. Why? Because to receive that help would be an acknowledgement of some things that they're not ready to acknowledge. We need to really work hard. If I can make a suggestion, and then I'll be done, is that we really need to work hard to counteract the misinformation and the terrible kind of it's like slapping every Muslim with the label of terrorist,
right?
Just because you pray to Allah. Come on.
Yeah.
We really need to work harder on that as a community. It's terrible. It's embarrassing.
Absolutely.
So okay.
Right on. It's important all that you've said, and I believe it was Hurricane Katrina that was the moment in which Cuba offered a medical contingent, and
they had offered before Katrina. They had offered help before.
Okay.
Yeah, this was in the, I don't know. Who was this, Gail? Come on, help me out.
It could have been Mitch. It could have been, there were so many that, but the gist, I get you.
Okay.
Don't worry.
Yeah, I mean, the point is Cuba has offered time and time again. And we will never know what the true number of attempts have been, because we live in a country where what runs on the newsreel is really not newsworthy, but everybody has to listen to it. And it's because that's how it's set up to be. So that is why we have to fight the disinformation and misinformation, why we have to be actively seeking out the right sources of news. And it cannot be from the mouths of the oppressors. The old African proverb is that, in the situation of the hunter and the lion, we never lived to know what the lion went through. Only the hunter lives to tell the tale. But in this historic moment, those of us who are paying attention, especially in this David and Goliath story that is Cuba and the US government, the lion is telling us every play of the predatory hunt that is going on, and the ploys that are being taken out by the US government to take Cuba out. We're hearing it, we know it, we see it. Some of us have lived it. So we have to uplift the story of the lion in this story as much as possible. We must spread what is really happening. And we have to do it the old school way. Oral tradition is the greatest pillar of our African peoples. And sometimes people want to use that to play us. Like, we don't know. We're not intelligent enough. I'm sorry, that's not gonna work. There's a system, there's a science behind our oral traditions, and we must continue to uphold that science and that tradition. Or else, what are our children gonna say? Our children's gonna say. We have to do it. But aside from that, going back to the question of what other forms of internationalism have been there, there have been military internationalism, as another example of Cuba, that has been in the polar opposite way of what we know militaries to do by developed countries. Cuba has sent its troops to different parts of the world, especially on the continent, from Algeria to Congo to Angola, and then in Latin America, in Dominican Republic, in Guatemala, different places to help the efforts of liberation, to help the efforts of self-determination. And one of the most important examples was that Operación Carlota in Angola, where Cuba sent its young sons and daughters, men and women, to go fight for the liberation of Angola and to fight off South African mercenaries, fight off apartheid. Please, that is the reason why Mandela stood up and said, US, you will not tell me who my friend is. You will not tell me who my enemy should be, because Cuba has been there. Cuba continues to be there, and we must uplift the truth. The truth is revolutionary. People don't want to hear it. That's too bad. That is too bad. It's not my job to pander to what you want to hear. That's not what we do. So we have to uplift the truth in the history. Let's not have amnesia again and again. We have to remember, and everybody is part of that project. Sometimes we can't remember all of it, just one person, and we should not rely just on one person. That's the point of knowledge and wisdom. It's supposed to be held together by every member of the community. So we have to keep this going. And so the military internationalism has been there with the sole purpose of helping others achieve what they themselves have been able to achieve as well. Guinea-Bissau, so many examples. We just have to invest our time in learning about this. And so that's one aspect. Cuba has also helped a sister nation, Venezuela, by sending educators, physicians, sports experts, economists, security forces. It's incredible. And that's just one country that has, that's an example, because in that moment, Venezuela was giving Cuba oil, and then Cuba was giving its human resources in this aspect. But it's something that has been happening for a long time. And I think one of the biggest examples, aside from medical internationalism and the military one, is the sports one, where incredible athletes, Cuban athletes, are incredible. What they're able to do, the training that they go through, and what they're able to share after the fact, going into other countries and training other countries' athletes to dominate on the world stage. Come on. And I mean, this is all living under brutal blockade. If people thought, yes, we can, started with Obama, forget about it. Si se puede started in Cuba. Hace tiempo. Okay, so we have to uplift that. We have to put it out there. We can do things, and arts and culture. Cuba, that's naturally a part of the internationalist struggle. What hasn't Cuba done to put out there the lingering hope that is African tradition, and through its art and culture? You can see the African running like it's just dripping. And that's why you can't reject that part of your identity if you are Cuban. It's contrary to nature. And so these are some of the examples. And the internationalism, I mean, when I even talked about the military internationalism, I remember my parents telling me about, some of my family members and other kids being sent to Cuba to train as commandos and come back to Ghana in order to serve the country. That's just one example, and they were taken at such a young age, just like the Burkina Faso children, just like the Angolan children. And they were supposed to come back and serve Ghana in a different way. Unfortunately, some people forgot what they were taught. That's not a common thing that happens. It's the betrayal of, you know, humanity sometimes that continues to perpetuate itself. But we keep fighting. We keep fighting against that incident. We keep insisting that there is a way forward, and it is a way that is full of progressive thought, that is full of goodness, not this parasitic, you know, behavior, opportunistic behavior. People only want to help you because they want to get something out of you. So I'm gonna stop right there. Uhuru.
Now, do you see why I have a hard time every time this sister goes? But I wanted to just drop in, Samira, that, you know, think about the musical contributions. Simply that's revolutionary contribution, just worldwide, the impact. So there are all kinds of areas, many arenas in which we owe a debt of gratitude to this tiny island nation. And I'm so proud and happy to see that that APDEP and IFCO seem to be finding a way to collaborate, because that's what it's about, collaboration. We collaborate as two organizations, then we can put our eyes on Cuba and help her, you know, and improve conditions there, because things are dire right now, as my two colleagues have already explained. We need to not, you know, we need to address many of the conditions there, like immediately, because it's not only affecting our students, everybody on that island is suffering. This is not, you know, the haves and the have not. I mean, can you imagine if you can take a look at, for example, somebody mentioned Katrina. When Katrina went down, the people who had means were able to leave and be able to be safe and safeguard their possessions, whereas other folks had to cross a bridge and were shot at to come back. Now we're not allowed to cross that bridge. I can't imagine that happening there. I cannot ever imagine it. So I would like to thank the leadership of APDEP and the leadership of IFCO on at least making these initial moves to you know, to do a greater collaboration.
Wow. Yeah, go ahead, Director Gale.
No, just saying, absolutely, I agree that making this initial connection and collaboration is really important, and looking forward to finding ways to really concretely follow up and find ways that we can continue to expand on this relationship. So just saying, uhuru, ashe, agreement, yes.
Vincent, was all of that.
Yes, that's right, all of it.
Yeah, and you know, and I just want to appreciate, even after I was reading your bio, Gail, about being a journalist, right? And then Samira talking about, you know, the importance of changing the narrative and controlling the narrative. And I want to encourage folks, the Burning Spear newspaper, which is the oldest revolutionary newspaper still in print since the 1960s, has the political analysis and is that breathing, living organ of the work of African liberation and the African struggle. So that's definitely a place where you don't have to look hard, because it's the whole truth is there. And so I encourage folks to use the Burning Spear as a resource, and especially students, as you're looking for, you know, just using this as a tool to help us continue to just block out, like you said, the colonial news that is trying to dominate this whole conversation.
So important. I think it was Samira who put into the chat, we put out a digital newsletter, if you will, weekly, called the Cuba Buzz. And it's really, I wish we had the time to kind of do more of our own, you know, internal analysis. It's looking at different places where people can get reliable news that isn't just the one-sided, you know, Cuba bashing message that we hear time and time again. So it's about trying to really change the narrative, as you just said. And I appreciate putting that information, the Burning Spear, out there as a reminder. But it's a similar initiative.
Both are important.
Yeah.
Yeah, you know, we can create these looking in many different, that doesn't just have to be one, because we have all these skills. And so journalists, you know, who are listening too, right? Donate and bring your skills to this work as well. So
absolutely.
Uhuru. So we have some more questions here. This one came in from our email. Somebody sent this to our info@developmentforafrica.org. And again, I want to thank our panelists. And this question is a little bit longer, so I might put it in the chat for each of you to read it as well, but I'll read it out loud. It says, we know that it is unlikely that the UN is going to be able to force the USA into lifting the blockade. Is there any long-term plans to topple the unjust structure of the permanent members of the Security Council, which may enable more just action? So any long-term plans to topple some of these unjust structures that are impacting the work?
If I could just jump in real quick, I worked for a period of time at the United Nations and worked at UN Radio. So it was a two-headed monster. On the one hand, it's like the place where, we allegedly grapple with, international issues, but you of course see all of the hypocrisy there. But there was often, conversations about how it is that we're going to undo this what is it, not a dictatorship, but this, control, this monopoly that the P5, the permanent five, the five permanent nations, the US, the UK, China, Russia.
Germany.
Is Germany one of the P5?
France.
Yeah.
Yeah.
Have, on this monopoly that they have on things. I think that, in so many ways, it goes back to the whole, foundation of the United Nations and who was there when they first kind of, tried to pull this whole thing together. So I think it needs to be a continuous conversation. I think it's important, regardless of the fact that, the US has ignored the vote, that the world nations, year after year after year, are holding that vote, and it's at least lifting up the hypocrisy of the fact that it's like the US and one other country, maybe two other countries, that stand isolated while the rest of the world says, no, this is absurd. That all said, the power of the permanent five versus the General Assembly is indicative of the imbalance of world power. And I think it's a good, important conversation, important question. I know that there have been, a lot of people who've really pushed to figure out how is it that you get other, if nothing more, at least a rotating, member of that body. They do have within the permanent five, they do have, I believe it's monthly, a different nation that will take on the presidency of that body. But that's not, it doesn't do away with the fact that there are five nations that have essentially veto, right? They got control over the whole pie. And so I think, it needs to be a continuous conversation. We need to continue to lift it up and even work within, our own, with own different governments to really see how is it that we can push to make some real fundamental change around that particular system, because the injustice is clear.
And see, Gail, that is why, some people are meant to address those larger structural issues. I'm a grassroots person.
Mhm.
I'm looking at Dr. King and the work that she does. Do you know what I mean? I'm looking at how IFCO and ABDEP and other small organizations on their own, but maybe some other people can attack and address those issues. I'm just speaking for a simple, not that the Dr. King is a simple grassroots person like myself, but I see the value in us from the ground up, just trying to topple whatever systems are in place,
right,
and moving them aside. We don't want this messed up healthcare system. We don't want this, like people are addressing the voting
voting rights
laws that are in place right now. Do you address that from the top down? That's not working. Fire Marshal Bill is not making changes. I'm sorry, President Biden. He's not making changes. to his structure. He's completely comfortable with it. So what do? We have to do things where we are. And I don't know if it would be a workable approach, but that's how I feel that those kinds of systems get toppled and removed. So the UN, to me, it was hilarious when 45 was saying, I'm not paying, I'm not going, because it laid bare the real structure of things. Because here they have somebody who wasn't complying with the game and the system. Mm-hmm. No matter that that he's a mental defective and all that, push that aside. Mm-hmm. He at that time was representing the powerful nation in the world, and he didn't want to play. Right. And so it kind of put these other entities into a panic. Like, oh, what are we going to do now? Now, fire marshal came in and picked up the mantle. He's running with the regular routine. He's back. Don't get me started on this. We're talking about health and healthcare. Dr. King, you're doing the thing, girl. That telehealth thing is all right. I was so impressed. So little things like that, not little, it's not a little thing, but things like that, it's not little at all. And that's what can change a system. Absolutely. That's what can change things fundamentally. So I applaud you, sis. I'm so, and may I also say that look at all of these women on this panel, excluding me, of course. Yes. But I am so proud. That's why, I don't know why, but something about Henrietta called me, said, girl, put me on your page, on your Zoom picture, because look at this. We women are responsible for a lot of moving and shaking. African women have to pick up this load and move with it. Of course, in conjunction with our brothers, but we, with health, maternal and infant health, it's Dr. King. Things go south when we give birth. Who does that affect primarily? That's us. Yeah. So we're picking up this mantle and rolling with it. I'm so proud and impressed with you all. I'm humble that you let me hang out with you. That's my family telling me to stop talking. For real.
Well, I will say that, yes, African women must lead. And thank you, Dr. Michelle Strongfield, for that. And, well, we have one last question coming up, because I know we're kind of running out of time, but I want to again salute all of our panelists. And this question is actually from one of our panelists to another panelist, which is great because this is what this is about. And so, Gail, I just wanted to share that we desperately need an alternative to the Red Cross, right, for our communities. Can we please speak more about Project Black Ankh and the concrete work being done to address emergency needs and health needs in our communities?
And if I can just attach on to the end of that, is that so often, there's a horrific situation that happens wherever, and we want to help. But who can we trust? How do we? So I'm really excited to learn more about, how is it that I can, not only for my own self personally, but for my family, my community, through the organization, here's a reliable source for, that's doing X, Y, Z. So just a little, I know we don't have, a lot of time, but just in broad strokes, what's some concrete ways that Black Ankh is filling that void?
Yeah.
Uhuru. Gail, thank you so much for that question. And before I speak to that, Gail, I just really sincerely want to appreciate this webinar. And I want to appreciate Dr. Samira for bringing the fire, for bringing the passion, for bringing just the strength of African women and the desire to be free, and to use our skills for the liberation of our people, and putting that front and center. I really, really appreciate that, and Sister Gail, my mom has been telling me about you for years, and to finally have an opportunity to, see up close the work that you're doing with IFCO Pastors for Peace, and the tremendous solidarity work that's being done, to make sure that all people recognize the significance of the Cuban Revolution and are prepared to do what we can to support Cuba's continued efforts to be a self-determining people, and uniting with just the tremendous solidarity that Cuba has historically and presently continue to give to African and other colonized people around the world, and even those who are not colonized, you know, prepared to give that kind of support. And Dr. King and Dr. Strongfields, who I've worked with for a long time, some of them my whole life, you know, and Comrade Michelle, you know, I just really wanted to say that before I say anything else. I really salute
thank you,
all of you, for the work that you're doing. And
you as well.
Thank you so much. And just to say that, you know, with Project Black, as I said, like in my presentation, we initiated the process to build Project Black in response to the to the Ebola epidemic in West Africa. We even had one of our comrades, a member of our organization, who actually died from Ebola. And that really made us recognize that even though we couldn't deal directly with, you know, providing care, we had to do something. And we knew, like you, Gail, that we couldn't trust we didn't see anything out there that we could trust to give our resources to. How do we know? Because we knew that when the hurricane, not the hurricane, when the the earthquake that hit Haiti, you know, 200,000 of our people, you know, dying in an instant. How many hundreds of thousands of our people displaced? And I can remember even in the community I was living in, and I'm just gonna call it by name, the Red Cross was out there soliciting donations in the middle of the street. Give money to Haiti, give money to Haiti. They got more than $1 billion in the name of helping our people in Haiti. And then ProPublica comes out with an expose showing that they only built 6 permanent structures with over $1 billion raised in the name of helping our people. We saw when Hurricane Katrina happened, our people drowning, standing on top of rooftops, being shot back off, you know, off of bridges, you know, crammed into stadiums. Dr. King was one of the healthcare providers working in that. She saw firsthand what was happening there. You know, Cuba offering help and United States government saying no. You know, we've seen this, and African people are constantly wanting to respond, and not even just in some isolated kind of fashion. The desire is there for us to respond as a united African people. When we see it anywhere, when we see the impacts of what is happening to our people anywhere, we feel it everywhere. Right. That's how we know that we are one African people. That's one of the reasons why we know, because wherever a Black person is feeling that pressure, we feel it, you know, we feel it. So Project Black has been born to be that emergency response, that disaster preparedness organization. And I will say that we're in the process now. I mean, we've done some things outside of the work around Ebola. When Hurricane Harvey hit Texas, our forces mobilized to help with the recovery there, providing food and water and other kind of supplies that our communities needed, in particularly in Houston. But it's really now, in this era of COVID, that we have decided that we will build this as a permanent program, and that the beyond the COVID work that is activated under Project Black Ankh, what we have in place now are plans to develop Project Black Ankh, so that in local communities, we'll be training local people. What are the natural disasters, for example, that happen in your area? Where I live is tornadoes, right? So, okay, we know when tornado season is. So what is it that our Project Black Ankh organizing committee can do in Huntsville, Alabama, where I live, to prepare our community for what we know is going to happen every April and September? We're going to be hit by tornadoes. So training on how to prepare for those natural disasters, training on how to respond, not only with medical care, but resources. There was actually Chiwaniso, who's our technician, during Hurricane Harvey. She was caught in a situation where her house almost on stilts, I don't know how many feet, 13 feet, 14 feet, was about to be overtaken by floodwaters herself. So we recognize in that instance, we were able to mobilize because of our efforts to get she and her family to safety. But we recognize we need folks who have access to boats, who can train and be mobilized to deal with that kind of thing. So that is the vision, that we will be building these Project Black organizations everywhere we possibly can around the African world, that are ready, stand ready, and mobilized to respond when there are natural disasters and other kind of emergencies. But also, and this is why we have such, we're so excited about this relationship with IFCO that is developing, is that we see that we want to be able to have the ability to have, to be trained, if possible, in the Cuban model of how to respond to epidemics. We don't want to be caught like we were caught in Hurricane Katrina, or during Ebola, where we can't respond, because we don't have the training. We want to be able to have our medical forces trained in that model, so that now if there's something that happens and the United States government says, no, Cuba, you can't offer your medical support, well, that's okay, because Project Black Ankh is here to be able to respond, and we've got that training, that understanding of how to move based on what Cuba has already developed. So this is the vision, and I'm so excited to be a part of a movement, and to be in a period of time where the consciousness of African people and other colonized people has come to a point where we know that we have to continue to fight for the self-determination of African people, just like the Cuban people have already done. Cuba has given tremendous solidarity, but it is on us to complete the Black Revolution. It is on us to complete the African Revolution. And we can take the examples of the past, the history, the solidarity, and the continued solidarity that Cuba shows, and advance it so that Cuba doesn't have to be isolated anymore. The tremendous resources of Africa should be used to help our brothers and sisters in Cuba who are being strangled by this immoral, blockade. But it can't happen because Africa itself is still in a neo-colonial stranglehold. So we have a responsibility, and we just see that there's nothing but tremendous possibilities that we can unleash with this relationship. And I'm just excited and highly appreciative of the opportunity to be able to be a part of moving it forward.
You talked about Samir being on fire. I laughed because we talk about that all the time. We're like, oh, she was on fire.
Yes.
She was on fire. And she was on fire today, and you're right. And I'm looking over at her, and we're getting, I'm excited about this. And I think that there are a lot of different ways that we can make some solid connections and expand on the tremendous need that we have in our communities. I love the way that you're referring to this, Dr. Aisha. We've mentioned it before, but I think I have a clearer, more concrete, vision and understanding of what the thinking has been and how we might, try to do some true collaborating, make this a reality. So thank you.
Thank you, Comrade Gail. Thank you.
And if I may make a comment quickly, I'll try. It is very impressive and humbling to see the creation of Project Black Ankh and the vision behind it, the purpose behind it. And I want to say, let us keep working at this, because honestly, we have so much to learn from Cuba. It is ridiculous. The response to disaster, the response to health crises, that is Cuba's thing. Cuba merges its whole public health response is a merging of disaster preparedness and public health measures put together for the sake of saving lives, one life at a time. For the last 30 years, Cuba has been ravaged by how many? Probably over 50 hurricanes. And how many people have died in these last 30 years? 17. Some number that is really small compared to the scale that we could only imagine if it was some other place, because we live in the United States of America and we know what has happened in the last 30 years in terms of disasters and the toll, the casualties of those disasters. And why is that? Because this is a business. Letting people die, letting people's property get destroyed is a business for this country. People get rich off of the insurance that they can sell you to keep, to build back your home, to pay for the life of somebody dying. It is sick. point blank period. In Cuba, that is far from the point. The point is to save a life, preserve the community. People come together, and that's why I want us to understand that, going back to Dr. Strongfield's point about being grassroots versus from the top down, it has to be both. The top must have a strategy, a national strategy. And in our case, as African peoples, we have to have our strategy in terms of disaster response, in terms of public health crisis response. We have to have a strategy that is coupled with the work of the grassroots, the work of the community. Because in Cuba, that's how it works. The government has the plan out there, but the people, block by block, are organized. Each block knows who's the most vulnerable person in their community, in their block, that, okay, I need to go help Miss Esperanza move her furniture from her bottom floor apartment to the highest floor, because, that's what's necessary for her to salvage the few things she owns, and for also to move her to safety. And everybody comes together to do it block by block, because it is the responsibility of the community to help save each other. But this is something that's outlined nationally. So people, once the call is made, once the alert is made that there's a hurricane coming or there's some other disaster coming, everybody knows what phase they need to be in and what mode of preparation they need to be in order to save each other. Life is important. Life is the basis of our humanity. And contrary to what we've been taught, and we continue to be taught in this system, every life counts. Every life counts. Whether you are quote unquote criminal or you are a saint, it does not matter. Your life counts. And that's what happens in Cuba. And that must happen in the rest of the world. That must happen in our communities. We don't get to decide who lives and who doesn't. It is incredible to have come back, graduated in 2020, and have lived through the beginning of the pandemic preparations in Cuba, and to see how in each and every daily press conference, Dr. Duran his voice would dip with just one person being reported to have died. One person. And then you come to the States, and they're just rattling off the numbers like it is just nothing. Just nothing. And even after these huge numbers are rattled off that have fallen, what do? We just keep going back with our lives. We just keep, perpetuating the same lies and keep thinking about ourselves, individuals. That is sick. The disease that we suffer from is not just physical. There is so many levels to this, and that's why our education must be decolonized. And that is what we learn in Cuba. That is why it's more, the medicine you learn in Cuba is much more than, just the science that is replicated throughout the world. We have the science, we learn the science, but all these other elements of how to think and how to protect our communities, I don't see where else that is being taught. So we have to continue to uplift this connection. We have to learn from our Cuban comrades, and we have to understand that they are a part of the African liberation story. From Haiti to now, we have to understand that they have always been a part. They have always upheld the liberation of other peoples up till now, even in their most trying times, still clamoring for Palestine to be free, still clamoring for Venezuela to be free, still clamoring for Yemen to be free. So many people for Western Sahara to be free. Cuba does not just say, oh, okay, that's your problem, I'm going to handle mine. That is not the way we move forward. Like you said, if somebody's ill, we're ill too. So we have to continue to push that idea forward, and we have to build and work. It is a tiring work, but it is a worthwhile work. And so we have to be committed to that. So Uhuru.
Thank you.
And remember, we're talking about a nation that is under the most ridiculous economic duress ever for 60 unrelenting years. If that doesn't make you get up off your hind parts and find you some people to collaborate with to end all this, I don't know what will.
Absolutely.
So thanks for having me anyway. I think I learned so much from you guys every time we talk.
Thanks for this wonderful program. We're so appreciative and looking forward to staying in touch and figuring out next steps.
Yes, definitely. I mean, I don't know if anyone else wants to add anything, or just Dr. King, you unmuted.
You guys are just wonderful, just a force. And with the power and the passion that we all bring, we most definitely can make a change. I just see it. I mean, the passion's there. So
I feel.
yeah, it's great.
Thank you, Dr. King.
Thanks.
Well, this really was a really inspiring panel discussion. I just want to really thank our viewers, our participants, our panelists for these, like I said, inspiring presentations, and just, I'm very moved, I guess is what I would say, by all of this. And as you mentioned, like starting from the bottom up. So this really starts with everybody who's listening right now. Your skills are needed to defeat what Chairman O'Malley has coined as the colonial virus, because we know it's colonialism that is the virus that has the chokehold on all of our people. And so, like Dr. Samira said, we have to really, start to continue to unite and to not give up on this effort. So I want to say again, this is our future in our capable hands. And if you haven't had a time to join or do anything during this webinar, please do so now. Save the chat if you're on Zoom so you can have access to these information later. And unfortunately, our time is winding down, but I really want to thank our panelists. Special thank you to you, Director Gail Walker of IFCO.
Thank you.
To you, Dr. Samir Adjari, coordinator of Elam School of Medicine. Thank you so much, Dr. Michelle Strongfields, director of EM and former Elam student, ABDIP volunteer, just everything under the sun. Thank you, Dr. Loretta King, nurse practitioner, volunteer, medical programs coordinator with ABDIP, Project Black Onc. And very special thank you to you and your leadership, Dr. Aisha Fields, director of ABDIP, the All African People's Development and Empowerment Project. Viva Cuba, Uhuru, self-determination is key. There's no other way to end this, but just I salute you all. So Uhuru.
Thank you, Uhuru.